We're going to talk about or re-talk about everything we've discussed so far, this time using images. So this is the first phase which we talked about, the proliferative phase. Notice the lining epithelium. It is obviously simple columnar epithelium. The height of the cells is greater than the width, and the cells are in the basal portion. And the lining epithelium is part of the endometrium, and then you see the representation of the lamina propria, which is the stroma. And in the lamina propria you can see these dots, and they're made using basophilic pencils, and they're the fibroblast. And you can also see the fibers made using the representing acidophilia, the various fibers which include the collagen type 3 fibrils, etc. So you have to draw the fibroblast, and you have to draw the representatives of the collagen type 3 fibrils, and obviously there are uterine glands because of the invaginations of the lining epithelium. And because of the way this section is cut, you see them as these lumens. Obviously the epithelium of these glands is also simple columnar. In addition, you can see the coiled arteries, and when you're drawing the coiled arteries, what you do is you basically draw this thickened layer, because this is an artery, so it has to have a thicker representation. And then you kind of draw the nuclei like this. The coiled arteries mean basically the spiral arteries, and you're not going to see them longitudinally because of the way this is cut, but you will be able to see them throughout the stroma. In the proliferative phase, they will not have reached the superficial 1/3 portion, as you can notice. All these capillaries are drawn in the deeper 2/3 portion. Also notice the representation of the functional layer. The functional layer is the superficial 2/3, and the basalis layer is the deeper 1/3. Right, and we can see again the representation of the uterine glands. We can see a lot more of them down in the more inferior portion. Then after the endometrium is the myometrium. In the myometrium, as previously mentioned, there is a more ill-defined situation. In some situations, in some books in Lycosan, it is written that there is an outer longitudinal and inner circular and outer longitudinal. But over here the representation is even more rapid. You can see in random directions the representation in this manner, and then in the representation of the dotted manner. And you can also see the blood vessels in the myometrium, and you can see the interstitial connective tissue. Which blood vessels would be in the myometrium? Well, they would be the spiral arteries, they would also be the basal arteries, and they would also be the arteries that supply the outer parts of the myometrium. You would also see the parts of the posterior and the anterior arcuate arteries. So this one is a representation of the secretory phase. Obviously this is very different. The lining epithelium is the same. Obviously it is simple columnar. My apologies. You can still see the uterine glands, but in this situation you can see that in the lumen there are the secretions. You can visualize the secretions, and this is something I mentioned when we were going over the theory. Again, you can see the representation of the lamina propria. You can see the glands are much more frequent. In the proliferative phase, even though the uterine glands were reconstituted, it was said that they're still narrow and they're straight. Over here you can see that they're no longer narrow. There is an obvious tortuosity, and even in these cross sections the tortuosity can be seen. So now you don't draw them in this manner. Also the coiled arteries are there, and now you also draw the coiled arteries in the superficial portion, because the spiral arteries have now almost grown till the level or till where the surface is. In the proliferative phase, at the end of it, when the thickness was 3 millimeters, while the coiled arteries did grow, they did not reach the superficial 1/3 portion. In the secretory phase, they have. Notice the labeling of the functional layer and the labeling of the basalis layer, because now at the end of this phase the thickness of this full endometrium is 6 millimeters, whereas before it was simply about 3 millimeters, and this doubling has been represented. The myometrium has not been shown because there isn't any change over there. Again, you can see the coiled arteries. You can see that the uterine glands, and it is represented that they've both hypertrophied and they've become tortuous. And the lamina propria is seen, and it is mentioned with edema because at the end of the secretory phase, the lamina propria has become edematous. Now this is the endometrium secretory luteal phase again. You can see the stratum functionalis and the stratum basalis. You can again see the uterine glands. They are tortuous and hypertrophied. You can see the connective tissue, which is edematous. This is after the menstrual phase. And you can see the disintegrating stratum functionalis. You can see the uterine glands. You can see the coiled arteries still. And you can see the lamina propria. But at the end of this period, the functional layer would have been completely removed and you would just see the stratum basale. And you can see the blood in disintegrating uterine glands because initially during the premenstrual phase there was this constriction of the spiral arteries which led to a damage, and when there was dilation at the menstrual phase and the blood rushed in, the arteries basically ruptured and the blood basically was removed. So you can see the coiled arteries and you can see the blood in their lumen. So normally they do ask you to make the proliferative phase and they do ask you to make the secretory phase. So that those are rather important things to understand. I'll go over this again. In the proliferative phase, the thickness of the endometrium is about, at the end of it, is 3 millimeters. The lining epithelium is simple columnar epithelium, right? And when drawing simple columnar epithelium, I should probably use a different color. Since it's columnar cells, so height is greater than width, and you should be drawing the nuclei nearer to the basal part. So that's how you're going to show the lining epithelium. And the endometrial glands are basically the invaginations of these lining epithelium, and you can see these invaginations over here, but you can also see them over here discontinuous or not in continuity with the lining epithelium. And the reason for this appearance is because this is a histological section, that is why they appear in this manner. Again, you can see plenty of these, right? And they're still lined by the same kind of lining epithelium, obviously. You can also see the representation of the coiled arteries, which you draw like this. You still use acidophilia to represent it, and then you draw in the nuclei. You draw these throughout the endometrium, but you do not draw them in the superficial most portion because in this phase they have not reached the superficial 1/3 portion. You can see there is a distinct lack of arteries in the most superficial portion, or a distinct deficiency of it. In the lower portion there is plenty of it, especially at the start. And the myometrium is basically you have all the muscles going in different directions. Sometimes you see them in a spindle shaped formation and sometimes in a dot formation. That is because the fibers are going in different directions. So this is the myometrium that is represented. In this one the perimetrium is not shown. The perimetrium can be serosa or adventitia depending. It is mostly serosa except the part that is in contact with the adventitia where there isn't any peritoneum. Over there it is simple adventitia. The rest of the place it is serosa because the pelvic peritoneum is also covering it. So that's the main difference that you need to be considering. Anyways, this is the end of it. Now we'll talk about the next topic.